Croix, and I'm so thrilled to have these awesome cohorts represented. So just to get us started, the format is going to be that we're going to have each panel member give a 5 to 7 minute introduction. Well, let me first start by saying that your packets have the basic information about the cohort, so we're not going to tell you that basic information. What we are going to do is address several topics relevant to life course research with these cohorts. So we've asked each panel member to tell us about the structural and methodological challenges to conducting life course research in their respective cohorts. Some of these cohorts are more tailor-made than others to doing life course research. We're asking each panel member to tell us about the capacity to do whether they have a biorepository, whether they've done biobanking in their cohort, and what omics might contribute in terms of life course research within their particular cohort setting. We want their ideas for innovative science using different methodologies, electronic medical records, mobile technologies, et cetera, and also some thought about if you were starting a new study, what would you want to include, having learned what we learned today about doing life course research. So as the moderator, I'm not going to start first, but we are going to let Di and Rebecca go last. So if you'll allow me the prerogative of a little zigzagging, I think we'll get by fine. So what I'd first like to do is have you just say your names and the cohort that you'll be talking about today, and then we'll do the longer little talks after that.
Hi everyone, my name is Zeyan Liew. I'm currently a postdoc at UCLA and also Aarhus University in Denmark. I've been working with the Danish National Birth Cohort for about 7 years right now. So I'm here to present our cohort and we'll discuss some of the aspects of our study.
Hi, I'm Linda McEvoy. I'm Associate Professor here at UCSD, and I'm very privileged to be representing the Rancho Bernardo cohort, which was started by Elizabeth Barrett-Connors, sitting right there. So she'll have much more detailed information and opinions on things than mine, but I'm very happy to be here. I've been working with that cohort for about 9 years.
I'm Jose Ricardo Suarez. I am Assistant Professor in Family Medicine and Public Health, and I'll be talking about our work in the Espina study, which is a study that I started in 2008 about child development in relation to pesticide exposures.
I'm Sheila Gahagan, and I'll be talking about the Santiago longitudinal study, which began in 1991 as an iron deficiency anemia preventive trial in infancy.
Hi, Amy Elliot from Sioux Falls, South Dakota. I'm the Senior Director at Sanford Research and a professor at the University of South Dakota School of Medicine. And I'm representing the Safe Passage Study, a longitudinal study on the effects of prenatal exposures, particularly alcohol, in relationship to stillbirth and SIDS.
You know us.